at 4 in today's Community Focus. As we've been reporting, Rhode Island is facing a shortage of primary care doctors, and now community health centers are sounding the alarm. Joining me now is Rilwan Feyisitan, the president and CEO of the East Bay Community Action Program. Rilwan, thanks for being here.
Thank you for allowing me to join you.
So just remind folks at home, what does your organization and other community health centers, what do you do?
East Bay Community Action Program is a large social service anti-poverty agency that is also a federally qualified health center. So we are the lifeline and safety net for so many Rhode Islanders. We serve 1 in 4 Rhode Islanders in Rhode Island, and we're part of a network of health centers here in the state that are really just open doors to our community. We provide so much more than just healthcare, but we are really that community pulse that connects communities and families to supports and services they may otherwise not be able to receive.
Yeah, so here on 12 News at 4 and on other shows as well, we've been talking a lot about the healthcare crisis in general. Talk to me about what you're concerned about. I feel like there's a lot of uncertainty in many areas around funding and sources of funding. So what are your greatest concerns right now?
We have those same concerns. We've been able to be in an era where we were healthcare heroes for so long, and now being the safety net, we're being stretched dramatically. And we're really concerned. We know your viewers have seen a lot of the news about closing down of practices, and that should raise an alarm of concern. Being in the safety net, we're equally concerned because we've not been able to have full reimbursement for the services that we do. Many of them are done with or without payment. We're that backbone for those that can't receive those services, and we're struggling equally as well. During COVID, we had the opportunity to receive a lot of that funding. We were asked by our state and our nation to take on more and do more, and we've done that, but that funding has long gone, and our reimbursement rates have not kept up with it. Inflation, cost of goods and services, and we're struggling to make sure that we can keep our doors open and be here as well.
So I understand you're asking the General Assembly for some help. What specifically are you looking for?
The first thing is what we can do, which is no cost to the taxpayer or to the state, which is to look at our drug reimbursement discount program. We're asking for the General Assembly to provide some really strong legislation that will help provide us from some of the big pharma issues that we've been seeing that have been dwindling those resources and those funds for some time. So they can do that right away and support that. And then we're also asking for rate reimbursement increases. Rhode Island, as many of you know, are lower than Massachusetts and Connecticut, our neighboring states. And it's really hard to retain our workforce and be able to put back into the services that we need with the rates being as low as they are.
Yeah, we were just talking with the House Speaker about that right here yesterday on 12 News at 4. He says the budget is tight this year. So what happens if you don't get that help?
Well, EPCAP as an organization just celebrated our 60th year 2 weeks ago, and we want to be here for another 60 years providing the services we do. We've been raising the alarm for quite some time that this is not a tenable situation. We need to be part of the solution, and we're going to need our state to be there the same way they were for healthcare heroes during the middle of a pandemic and an emergency. We are raising the alarm. We're asking people to make that investment for our elected officials to do that. We don't want to be on that list of folks that have had to make really dramatic cuts or closures. We want to be the safety net, but we also want to keep doing the incredible service of care at very high levels. This is not the time to walk away from making strong investments in the work we do.
All right, we will stay tuned. Rilwan Feyisitan, the president and CEO of East Bay Community Action Program, thanks so much for being here.
Thank you.